A huge proportion of COVID deaths across the country have occurred in long-term care facilities.
Almost 600,000 people have died in this country, but nearly 180,000 of those deaths, so a third of them have occurred in nursing homes or long-term care facilities, when only 1% of the population lives in such facilities.
Dr. Mark Henderson of UC Davis says the numbers in California are equally as staggering.
In late December, early January, during the latest surge, almost 100 patients per day were dying in nursing homes within California. And today it's 1, 2, 3 per day.
The number of infections in nursing homes have also plummeted. According to a study by the American Healthcare Association and the National Center for Assisted Living, there's been a 96% decline in COVID cases in nursing homes across the country from December 20th to March 7th of this year. Dr. Henderson credits the widespread vaccination efforts among that community. But he's also quick to point out it's not just the vaccine that got us here.
These nursing homes have changed their practices. They have implemented distancing protocols. They mask. Visitors now mask.
Nursing homes and assisted care businesses have been hugely affected. Many workers became sick and their businesses took huge losses. Many aren't even in business anymore. Kathy Herfeld owns Home Care Assistance of Sacramento.
From a business perspective, we saw an immediate 20% drop in revenue from February of last year to March of last year. And then from March of last year to April of last year, we saw a 40% drop in revenue.
When asked what they've learned the most from these positive numbers being released, both Herfeld and Dr. Henderson had the same piece of advice.
Get the vaccination. There's no reason why you shouldn't.
The lesson is get vaccinated as soon as you can and with whatever vaccine is available.
Walter McCalla, KCRA 3 News.